On the issue of the medication, we took the decision there in terms of the presence on the ground for persons to report where they are having difficulties as it relates to other support that they need. Now, it's very important to state that within the community itself, there are, or certainly today, there were about 15 health workers on the ground, and I understand it's a daily occurrence, interviewing, doing temperature checks within the community. So a number of persons are present in the community, and therefore persons have the opportunity to outline any concerns to them. But nevertheless, we will increase that to place someone at the main security post so that they can have additional support to voice any concerns that they have. I say this to say, in relation to the question that was asked, that part of the temptation to leave the community is a view or a perception that they are not getting what they would be accustomed to. And one of the reasons for the discussion, for the visit, and for the decision to expand what is available is to attempt to make the citizens as comfortable as possible while they go through this period. It is impatient of debate, having listened to the Permanent Secretary and the CMO, and you've seen the graph here, that the decision that was made around quarantining that community was a right one. It is obvious. I mean, 30% or a third of the cases so far are linked to that index case. And the truth is, if that wasn't done, a lot of other things could have happened. So I really want to commend the team because it was a right call, the right call. But having said that, we do have a responsibility to ensure that the persons living in the community who are being quarantined are given the maximum or the best possible treatment, and we're going to be doing that. And my visit was to try and address some of those shortcomings, if there were any.
My other question is, so the patient who just died from the COVID-19 complications, I'm being told that he was being transferred to the UHWI to be put on a ventilator. Is it that only UWI has a ventilator? And if that's the case, understanding that this is a disease that really affects the respiratory system, what real chance of survival do the elderly have if they do contract this virus?
The person was being transferred for intensive care, which is a little bit more than just being put on a ventilator. I mean, we do have ventilators in our hospitals. However, in terms of intensive care facilities, that is where we do have a critical shortage. This is why the ministry is moving to get more ventilators, more high dependency spaces. And the spaces does not just include the ventilator, but all that goes with it. So we do recognize that there is a shortage in this area. It was not that there was a lack of a bed for this person. It was just the timing of the movement of the person, because we have to assume we have to get some amount of stability and have everything in place before the movement can occur. So all the arrangements have to be made, and all the arrangements for transfer as well. So it's not that there was a lack of space for this person, but it's just that in the process of, the patient did deteriorate quite quickly, and so sometimes we are not able to time these things to allow the interventions at the right time. But we do recognize that there is a critical shortage, and therefore in planning for this and in anticipating that there would be more need for these beds, that is why we are moving to get these beds in place. Okay.
Can I just say too, in relation to that point being raised by the Chief Medical Officer, that I'm being advised that since the start of the process to prepare the for want of a better term, the COVID wards in our hospitals, which means identifying isolation areas in every hospital across the country. I'm told that that has gone fairly well, and there are approximately 240 beds that can now be classified as isolation beds based on each hospital establishing an isolation ward. Now, I'm sure more work needs to be done in terms of the various equipment and so on, but nevertheless, I want to thank the respective hospitals, the SMOs, the CEOs, and others who have followed the directive as part of the preparation to isolate an area for COVID patients should the need arise.
Excuse me, Balfour Henry from the Observer. I didn't hear the Permanent Secretary respond to the question about when the gentleman who died returned to Jamaica. Did you? I think that was asked earlier.
Yeah.
Right. So we're in the process of getting the information now. Okay. I can tell you that the person was admitted at Lioneltown Hospital on Monday the 16th. In terms of verifying all the other information has to come in, and then we will be able to verify those and to pass it on to the public. Because if it needs that, we have to trace back to when the person came into country. We have to determine when did he start having symptoms. Was it that he came into the country with symptoms? Did he start having symptoms when he was here already? Those things have to be determined.
But you're sure that he's a Jamaican?
It is a Jamaican.
And he lived in the United States?
Mr. Henry, I don't want to give you any wrong information. Allow us to verify.
How much you know.
But our information is that it is a Jamaican who returned from New York.
And he lives in Clarendon? I mean, his family is in Clarendon?
I cannot tell you his home situation as yet.
But that's where he was.
He was in Clarendon. Yes.
Where in Clarendon?
Mr. Henry, as soon as we get all the information, that we'll be able to pass it on.
And it's on that note that I want to make a point. We are getting too many reports of discriminatory behavior towards persons who are presumed or suspected of being infected by COVID. And it's becoming problematic in that people are denying services. And we have to intervene. Because now that we have had a good nearly 2 weeks of this operation, we are going to start the process now of what you call discharging patients, and the CMO made mention of it. And we have to integrate persons into communities. They have to begin to normalize their lives after they leave hospital. And if we generate this amount of discriminatory activity, it can cause severe outcomes that we do not want to occur within our society. And so we have to be cautious around how we manage the information and how we create any sort of anxiety within the public. As was pointed out by the CMO, the case that we have today is part of the high-risk group that COVID-19 will impact negatively. Elderly, comorbidities, meaning having chronic diseases in most instances. And therefore, we have to manage that information and let the public know that the recovery rate for COVID internationally is moving in the right direction, and it is showing that only 20% of the persons, under 20% of the persons who get the infected become even ill enough to want to want to go to hospital. And so we have to send that message out. We have to send that message out. It is not a death sentence. Right? Okay? Yeah? All right? So, yeah, sorry.
Yeah, man, Dwayne Anderson again from TVJ. This particular death and some of the early positive tests point to persons who just returned to Jamaica. Are the protocols at the airports not working so that these persons or carriers can be flagged early?
Are the protocols at the airport not work so that the person can be flagged properly?
Okay, so as you know, initially we had put in the restrictions on certain countries where there were large numbers of cases. We have now moved to that persons that are returning from any country where there is active transmission, that these persons should home quarantine. I think this re-emphasizes the position of the Ministry of Health and Wellness that it is important that persons self-quarantine. Persons who are returning from countries where there is active transmission of disease must self-quarantine. Call the Ministry of Health if you develop symptoms, and we will be able to guide you. It is better you call us, we are able to assess what your symptoms are, direct you, and be able to receive you in a facility than to have you moving throughout the population. So this is an effort, it is to contain any illness that there is. In terms of, somebody asked earlier about panicking. I would say to the population, now is not the time to panic, now is the time to act. Now is the time that you must become more aware. You must become aware of the personal measures that you need to take to protect yourself and the measures that you need to take to protect your family. If you have family members that are returning from countries where there are active transmission, and it is very clear that 10 persons out of our 15 cases are imported cases. That is very clear. So if you have relatives, if you yourself have returned, then stay home. For the general population, even if you don't know, if you have had contact with somebody who have had COVID, if you are sick and you are having flu-like symptoms, cough or cold, stay at home. Our numbers are available for you to call. Not everybody is going to get through at the first time they call, but call again, because we are working 24 hours to answer those calls, to settle people's mind and to provide them with help. Don't panic. It is really time for everybody to take a part in controlling and stopping the transmission of COVID-19.
I realize that the signal is being sent for a wrap-up, so I'm going to try to make this question into like 3 parts. One, A, B, C. First of all, obviously this is a country of many people with NCDs, so I'm sure they would want some sort of assurance. One of those assurances I'm sure could be the supposed drug in Cuba. What is the status of our attempts to get that drug if it is indeed available? Also, has the Prime Minister been notified of this death? What has he said? And is there a COVID-19 case in Mandeville?
Well, I'll start with the last one. So you know that we have a person isolated who is the father of the first case at Mandeville Hospital. And then we have this person who died, who was at Mandeville Hospital. So far, we have not received any other notification in the National Surveillance Unit. But notifications are coming in every day and they are reviewed. So things are fluid and they will change. But as of now, those are the 2 persons that we are aware of in Mandeville Hospital. We had a person that was at Percy Junior Hospital. That person was tested negative and has been discharged home. So that's Manchester. That wraps up